I'm Norma Howarth. I'm the locality manager for Change Grow Live Forth Valley Recovery Service, and I've got with me my colleague here, who's Julianne Edwards, who's was one of our peer harm reduction navigators, who's now a justice recovery coordinator within our service in Forth Valley. So thanks SDF for allowing us to come today. We're really excited / two very nervous women up here, but given the fact I got up there, didn't fall. Good start to the day and managed to drive in. So yes, we're Forth Valley. We are a 44-person team over in Forth Valley. I've got quite a few of my team here today, and my boss, no pressure. And we deliver psychosocial support, recovery coordination to individuals across the whole of Forth Valley, which is 3 locality areas of Falkirk, Clackmannanshire and Stirling, and we have a dedicated harm reduction team, which is the host of the project that we're talking about today. So the background and introduction is that we have had the honour of developing the innovative approach to the provision of harm reduction and early intervention through the creation of the peer harm reduction navigator posts within our dedicated harm reduction service. And it started back in 2020, where we had pilot funding for 4 peer harm reduction navigators, and that came under the Falkirk and Clackmannanshire and Stirling Health and Social Care Partnerships COVID mobilisation plans. And back in 2020, we got given the funding and we started the recruitment process. And to be perfectly honest, we didn't really know what we were doing and didn't really know how we were going to use these posts, but we felt it was something that we could develop with the peers at that time. And in that year, we took an exceptional amount of learning, a lot of development, a lot of growth, and we applied to the 2021 Improvement Fund and were successful to receive 3 years funding to recruit 12 peer harm reduction navigators over the course of those 3 years, which was for a year. And obviously we're targeting people who have that lived experience of drug use from across Forth Valley. So I'm going to give a shout out in a minute. So these guys gave me these quotes. So the foundation of the peer harm reduction navigator roles is their own lived experience. That's the crux of it. Where we've got this sharing this, it's a powerful and a valuable resource for engaging service users, particularly those who may present as ambivalent or perhaps without any insight or hope, maybe anxious about engaging with services, anxious about engaging with helpers. And the peer harm reduction navigators offer that genuine understanding of substance use through their own lived experience, and they use a language and an approach and an engagement style that's familiar, relatable and connects with people. This approach builds trust and supports the engagement with individuals who typically, within our own experience in Forth Valley, have been hard to reach and therefore increased vulnerability and more likelihood or predictors for potential adverse events, including drug death, near-fatal overdose. So Kev and Julianne and Ian were part of our 2021-2022 cohort who came from the Innovation Funding. I just want to point out at this point, for us in our recruitment, people don't have to be out of service to get a peer harm reduction navigator post. Individuals can still be receiving opiate substitute therapy. That's absolutely fine because there's no barriers to employment in our perspective at Change Grow Live. So the process in which we actually developed is quite straightforward. The funding allows us to employ 12 people for 1 year contract each. And within that 1 year, we're giving individuals as much support and training and resources as possible to be successful in future employment. So we've got connections with SVQ2, thanks very much, AWTP, Scottish Drugs Forum, because we've got our peers who are engaged with that training process. Access all the training that we possibly can under Forth Valley and within Change Grow Live, and really do that development and skills development. So for some of our peers, this is the first role in a substance use service, but for some of our peers, this is the first role in employment ever. So therefore, what we're putting forward is a whole mentorship approach to enable individuals to be as successful as possible within this 1 year contract and to really learn the skills and develop those insight and knowledge to be their own best person in their next employment. So we've been quite successful so far. So of the peers that we've recruited, 5 have got into substantive posts, including Ian and Julianne, and peers previously. We've already got peers still working with us, and as of Friday last week, we've just recruited 2 more peers who are going to start working with us as soon as all the employment checks have come through. So we're really getting that momentum of people. So I'm going to hand over to Julianne, who's going to tell you a little bit about her. And the background slide that I'm going to ask you to read whilst Julianne's speaking just gives you a little bit of a rundown in terms of the work that the peers do from a functional point.
Hi. I'm just going to tell you a wee bit about my background. I was already in service with Change Grow Live before I got this position. So I was in heroin addiction for over 30 years. Eventually got stable. I volunteered for the service for a year, and I got into paid employment. And I've got to say, it's the best job I've ever had. Totally love my job, being able to give something back and to give hope to my service users, because I think that's very important, to be able to give that look, I'm living proof that you can change your life if you want to change it. Just to be able to give that hope to people just speaks volumes. It's just amazing to do the job that I actually do. I've got to pinch myself sometimes that how much my life's actually changed, and I just feel so healthy. I feel mentally healthy, physically healthy, but my job's very important. It's just, you think that, no, I would never be able to do that. You can do it. Anybody can do it. I'm living proof of that. So that's some of the stuff that we do. We do assessments, triage, get them into service, naloxone supply, injecting equipment, advice, dry blood spot testing, information, advice, signposting. We do a bit of everything. Really, but yeah, so that's it, yeah.
Thanks, Julianne. The whole thing here is about those points of contact at first point into service, when people aren't in service, out on the streets, and it is that embodiment to say, hello, let's have a conversation. I might have had a similar experience to you, so it's just been fantastic. So in terms of what we're here to talk about in terms of the impact, just a wee bit of a data dump really, just to give you a bit of an overview of what the team have achieved, is that overall, through the introduction of peer harm reduction navigators in the service, we've had a 36% increase in the number of individuals who's been in contact with our service. I mean, that's phenomenal, particularly at the times when we are looking at a significant battle, an increase in numbers of drug deaths and near-fatal overdose. We've assisted 216 people to access medically assisted treatment with our statutory substance use partners, and that's through triage and assessment and engagement in assertive outreach that Julianne just described. And overall, we've got an additional 1,000 contacts, individual contacts, in a 12-month period. I mean, this is phenomenal given the fact I'm talking about 4 people in addition to the service. So the impact's there. But I also want to talk about the influence. And I used this diagram because I just thought it encapsulated quite well what my thoughts were in relation to the peer harm reduction navigators. And because the theme of the conference today obviously is about looking at emerging practice. So in addition to the impact, the numbers, the statistics, the output, if you like, the peer harm reduction posts have got such a significant influence. And I broke it down into these different spheres. The sphere of control in the centre is where the peer harm reduction navigators have, without doubt, added capacity and quality to the service that we're delivering in Forth Valley. They're reaching more people, they're having more quality engagement, they're having more success and more outputs. So basically we've got that bit where the peers are also having their own successes by gaining employment and moving forward with their lives. But as this slide illustrates, that sphere of control is the smallest part. That's the bit where we have the greatest influence because we can manage that within our own internal structures, training, support, and opportunities that come up with our governance and with our feedback from our peers. The sphere of influence is the part, however, where the peers arguably have their own place within the world. Their visible work across Forth Valley, not just with our service users, but with our partners, and I think it dovetails quite nicely into previous conversation looking at stigma, where our peer harm reduction navigators are advocates, they are community champions who are out there talking to everybody and anybody, and I know that you talk to everybody and anybody, as do you guys at the table, to basically talk about our service user group, about the work that we do and about the lives that people are leading and the support that they require. And that influence is getting broader and broader and broader because the visibility is out there in a variety of different settings. That in itself hopefully will influence other professionals, other helper groups to engage with people and to bring them into our service for the more structured support. But lastly, we've got the sphere of concern, and that's the one that wraps around all of us. And the sphere of concern is that you've got everything you might be concerned about, but you can't necessarily control or influence. So it's out with something that's my gift or our gift. However, what we've got here really is about concerns about employability, concerns about restrictions that may come through offending backgrounds, the impact on future options, the benefit system and so forth. But basically, although we can't control or influence it, we can raise our concerns around it and we can share our experiences from a peer perspective to perhaps start to making some influence and to start making changes that we can control or influence others who can control those changes. So finally, for the learning points for us, and these are great, and I was sat reflecting on these, and I did discuss these with the team before I put the slide together. And from 2020 to just now, the first and foremost, it's starting at the very beginning of that journey, and that's that recruitment process. So what we have learned is the key to success is the approach to recruitment, to engagement and promoting these posts, being clear and realistic on the nature of the role, what a peer role is, what the limitations and the boundaries are. We've not got capes on. There's things that we have to work around. Having open conversations about how the work and the responsibility of this paid role can impact on a candidate and how that could be quite a significant shift. For those that are still receiving support or treatment within our services, we're also clear on how support and treatment could be managed alongside employment, which also includes conversations with that person's key worker to make sure there is confidentiality, there is respect, and there is an open communication so that everybody feels supported in these roles as a colleague, as a peer, and as a person still receiving some treatment. We're setting that tone so the peer knows from day one of the recruitment that there is a safety net there, that there's a huge plan, and that we've got a collective responsibility to support people to succeed. The second point is one of the ones that I wanted to draw attention to, that lapse and relapse is a part of our world. CGL actually has a really robust and very useful relapse policy. To be honest, I don't know if many organisations have that, but it's very useful for us to act as a guide and to help us in these circumstances. And I want to talk to you about Charlie's story. So Charlie was our first peer, actually, in the 2021 cohort, who started as a volunteer with Change Grow Live and became a peer. And he knows I'm talking about this today. We asked his permission. He's like, oh yes, I want you to talk about what has happened with me because this is a reality and people need to know. So Charlie worked really, really well up until a point where circumstances in his life changed and he did relapse. He was very open and managed to get support from Paula, who's the team leader for that team, so that we could actually work with Charlie to help him. At the time of his relapse, we spoke to Charlie to say, how do you want us to manage this with your peers, with the rest of the colleagues? And he said, tell them, I want people to know what's happened because it's not shameful, it's not hidden, it's something that's part of my life. And actually, I'm really, really impressed with myself, I'm proud of myself. I've achieved a lot to get to this role and I've really enjoyed it. And things haven't worked out this time, but I'll be back. So we supported Charlie to exit from that role, supported him into treatment, and he's doing really, really well, quite happy to say. And he left that post with dignity, with respect, and with an open invitation that should he wish to, and his circumstances come back, and he's more than welcome to come back, because the impact that he made whilst being a peer was exceptional. But it's something as organisations, as services, as colleagues, we need to be aware of that there's no straight line here, and actually from that starting point to people's exit, there can be bumps on the road. So Charlie wanted to share that with you today, and it's my honour to do so. Coming alongside that, and I said at the earlier part with our journey about mentorship and support, we need time. That's one of the things we learnt in 2020 was time. We've got to dedicate the resource and the mentorship and the training and the support to our peers, because there's a lot of different experiences, a lot of different starting points. So it's not an add-on, it's not something that we can actually just pop to the side and let people just drift along. We've got to invest in that time. So have that mentorship from across the whole staff structure, so that everybody has got that involvement in that person's growth and development. And then just be prepared, basically, as a service and as a candidate. And again, this is what we do at day one, that as the services that we run, each of our workers and our volunteers have to become members of the PVG scheme, and that's not always easy. There are certain offences, there are certain things that happen in people's background that mean that a person might become listed, considered for listing. We don't know that until we send off the PVG application, and it can be a very long and protracted process of actually understanding if somebody has been considered for listing. We can appeal that, the appeal takes longer, and then it could be, and we've got this with one of our peers that was recruited last Friday, that it's been, I think, 18 months on that journey, and that's a long time to wait to actually do something that means so much to a person and the reasons why they apply for it in the first place. But it's a sphere of concern. It's not something that we can influence, but we have to be honest at that point of recruitment that actually this might not be a fast process, even though we value your skills, your knowledge, your experience and your motivation and enthusiasm to join us. Sometimes we can't progress with that employment, and that's quite a sad position to be in, but it's about being honest and open with that. So overall, in the last 3 years, it's been a phenomenal journey that we're going to be carrying forward for the next couple of years. And now that we've got my peers with me, they'll be part and parcel of answering questions as we go along. But this was the information, this was our journey that we wanted to share with you today. And thank you very much.